If you have any type of symptoms related to this smoke, and you would note chest tightness, wheezing, coughing. Yeah, at first, sometimes the particulates affect your nose, so you could have some nasal symptoms. If you feel like it's hitting your nose, then part of that's getting into your lungs. And and you could, of course, blow your nose and do some like nasal saline, something to clean it out, but you don't want to keep on breathing that smoke in. You need to get away from the smoke as soon as possible. As far as if you absolutely have to be in the smoke or if it's inside your house, you can get a respirator and you can get those. And that would be recommended for those people that absolutely have to work outside and it's part of their livelihood. Otherwise, avoidance. You want to avoid the trigger, avoid the bronchospasm. The issue with smoke, it's variable when you're talking about a fire. When you're talking about fire, different things are burning. And all of those cause different types of chemicals to get released. And you have carbon monoxide, carbon dioxide, you have all these other toxins that can irritate even a normal person's lung. And if you're pregnant, of course you shouldn't be doing that right now. Right now, I wouldn't recommend anyone running or exercising outside when the smoke is in their lungs or they smell smoke. I am so concerned about this horrible smoke damage to my patients. What we want to do is make sure they take care of their lungs. They avoid any triggers. They have to look for the smoke triggering their asthma, making them short of breath, coughing, wheezing, getting a tightness in their chest. And it affects especially patients that also have any cardiac issues. Often the issue is you have the lungs are so interconnected with the heart, and those patients have to be very, very careful with all the particulates that are in this air and how it causes damage to the lungs acutely and sometimes long-lasting, and that's what we want to prevent. There are several key points that they should do. Number one, avoid going outside, avoid doing any type of physical activity because that will definitely cause a trigger to their breathing issues. They should stay inside, they should close their windows and their drapes, and they should take their regular medications. And they should have a plan in case things do get worse. They should have their rescue inhaler, a nebulizer if they have it, and if they absolutely need to, then they need to go to the hospital or call their doctor.